Question is that this bill be now read a second time, and I call the honourable member for Fisher.
Thank you, Mr Deputy Speaker. I rise to speak in support of the National Health Amendment General Co-Payment Bill of 2022. And I am very pleased to speak on this bill, which is, of course, yet another coalition policy. They say the best form of flattery is imitation, and this bill is no different. But I'm not going to stand here and complain, because this bill ultimately results in a good outcome for the Australian people, and the coalition supports it because it is very much in their interest, particularly as we are dealing with cost of living pressures right now. On the 30th of April 2022, so before the last election, the coalition announced an election commitment to reduce the PBS general patient charge by $10. But not to be outdone, Mr Deputy Speaker, just the very next day the Labor Party came out and announced that they would be reducing the change by $12.50, a $2.50 improvement. And that's very, very good policy work. But it is years in the making. I may jest a little bit, and I say it with a smile on my face, but it is a good outcome. It's a good outcome for Australians. But what is becoming increasingly clear is that the Labor Party don't have any of their own policies. They continue to look to the policies of the coalition for addressing the cost of living. We support Labor's bill to reduce the maximum general co-payment for medicines on the PBS, of course, whilst we note that it is a copycat policy made from our policies. The bill will reduce the pharmaceutical benefits scheme general co-payment by $12.50 from the current amount of $42.50 to the new amount of $30. Now, I want to point out that this doesn't take effect until the 1st of January 2023. If this Labor government really cared about the cost of living pressures faced by Australian families and their businesses, they would have pursued this policy. They would have pursued the introduction of this bill in their first sitting. What Australians are really worried about right now is their financial stability and national security. While Labor dances to the tune of Republicans, left-wing academics and the militant unions, Australians are sitting around their dinner tables worried about their financial future. They are worried about how they are going to continue to put their kids through school, how they're going to continue to pay their mortgages. These are very, very real issues that Australians are grappling with on a day-to-day basis. They worry about whether they're going to be able to put food on the table for their kids. They worry about whether they're going to be able to put fuel in the car to drive to work and take the kids to and from school. And they worry about whether they are safe. They are worried about whether they are safe from malicious actors who are attacking our essential services through online attacks. They wonder about whether they're safe from national security threats after the dismantling, effectively, of the Home Affairs Department. They wonder whether they're safe from geopolitical threats. They wonder about the decisions of this Labor government in vacillating on important defence projects, like whether they should be replacing the Taipan helicopters with Black Hawks. Now, that's an absolute no-brainer, but the Defence Minister, in his ultimate wisdom, has decided to effectively put that project on hold, Mr Deputy Speaker, and conduct a review as to whether they should be doing that. I mean, these are important projects. These are important defence projects that this government should be backing us backing the coalition government's decision in. You know, the Labor Party talked the big talk about defence being bipartisan, but
members raising, but I fail to see how they bear much reference to the bill before the House.
Please proceed.
Well, I thank the honourable member for his point of order, but these issues do directly go to cost of living. They go to cost of living and security. How Australians believe that they are best served by a government who want to see action on cost of living and security, whether that be national security or the security of their own bank accounts, security of their own records. And if the member opposite thinks that that's not relevant, I don't know what is. Mr Deputy Speaker, Australians want a healthcare system that provides them with safety, with a degree of comfort, just like they want a government that looks after them in relation to things like industrial relations. When members opposite are pushing through reforms in this place that will see union lawlessness by the abandonment of the ABCC, Australians want to know that their taxes are being put effectively to work. They want to know, through things like the abandonment of the ABCC, that our costs of construction are going up by around 30%. Not my words, the NBA's words. Australians want to know.
Sorry. For Sydney.
I think we have ranged pretty broadly from the topic of the legislation before us, and I'd ask you to suggest to the member that perhaps he might like to return to the legislation that's being debated.
Yes. All right. Please proceed, member for Fisher, and try and address the question before the chair.
Well, thank you, Deputy Chair. And as I noted earlier, these are important issues which go to the heart, and I would take the second point of order that's been raised in relation to relevance, and note that the Deputy Chair didn't find in favour of the first point of order. But be that as it may, Australians want to know that their government has their back. Australians want to know who's in charge and what the government is doing to relieve cost of living pressures. Now, this is a question that is directly on point to the minister at the table. This is a bill which the government is putting up as a cost of living easing pressures on Australians. Between 2013 and 2022, the coalition government made nearly 2,900 new or amended medicine listings to the PBS. In the last year of the coalition government alone, 2.2 million free or subsidised medicines were funded just in my electorate of Fisher through the PBS. In our last budget, we invested an historic $132 billion to deliver the essential health and aged care services Australians need. Now, let me say those figures again. In our last budget, $132 billion, an historic amount compared to the Labor Party's budget of just $75 billion when they were last in government. $75 billion 2012-2013, $132 billion. And yet, for 6 years, all we heard about from those opposite were cuts to the healthcare system. Now, I'm no mathematician, Mr Deputy Speaker, but $75 billion in 2012-2013 to $132 billion in our last budget, and yet those opposite consider that as a cut. Despite what Labor may tell you, Mr Deputy Speaker, we strengthened Medicare and revolutionised health treatment with our telehealth system. We committed $133 billion over 4 years to continue bolstering our Medicare system, a jewel in the crown of Australia's world-leading health and social care infrastructure. On that, I think we all agree that the Medicare system in Australia is probably the best in the world. Australians demand, rightly, an effective healthcare system, and the Coalition has always been absolutely committed to delivering on that. In government, we delivered a 133.69% increase in funding for public hospitals in Queensland. It's a record funding to a hospital system which Queensland Labor, in my state, continue to mismanage. After nearly a decade of reform, record-breaking investment and action, the Coalition has set the standard for healthcare in this country. But what's the real cost of living in Queensland, Mr Deputy Speaker? We talk about the cost of living in this place and we talk about healthcare. Australians are already tuning out from this government because they know that federal Labor isn't listening to them. They know that just after 6 months in power, this Labor government are hopelessly out of touch. On the 4th of April this year, the now Prime Minister, in the lead-up to the election, announced to the Australian people that he would govern in the style of Queensland Labor. Now, when I say that, around about 4.5 to 5 million people in Australia, namely Queenslanders, are rolling around on the floor laughing right now. He said, and I quote this from the Prime Minister, "But I have also seen what Premier Palaszczuk has presided over as a bit of a template for the way forward for federal Labor." Now, let me tell you, Mr Deputy Speaker, Queenslanders are shuddering with this news. Let's take a look at the cost of living in Queensland under a Labor state government. Roads are congested because of Labor inaction. A drive down Caloundra Road in my electorate will demonstrate that the state members for Caloundra and Nicklin are not listening. Rail projects are over budget. Cross River Rail is over budget. It's late. North Coast Rail duplication. Well, that's just being delayed by the state Labor government. The state Labor government take the Sunshine Coast for granted, like Labor the state over, and in fact, both at a federal and state Labor parties, they are choosing red carpets and photo ops over looking after people. What has Labor done from a healthcare perspective in Queensland? Now, ambulance ramping is at levels that are unprecedented. Paramedics and patients were ramped for nearly 123,757 hours last financial year. In 2021-22 financial year, Queensland paramedics and their patients were being ramped for more than 357 hours every single day. Hospitals are overwhelmed and our hard-working nurses, doctors and frontline staff are struggling to keep up. Maternity wards in regional Queensland have been shut down, and mums-to-be are being handed do-it-yourself birthing kits in regional Queensland. This is a disgrace. The integrity of Queensland's DNA labs is now subject to an historic commission of inquiry. Bullying, secrecy, cover-ups, photo ops, name changes and political games cannot mask the frightening truth. The fact is, in Queensland, the cost of living comes from the risk of financial and physical peril. From Cairns to Caloundra to Coolangatta, Queenslanders have seen the cost of Labor in government. This is federal Labor's blueprint for government. This is their template, it's their goal, and that should alarm every single Australian. Every young couple in regional Australia who may one day want to start and raise their family beyond the big city should be very, very worried. Every senior Australian who relies on public health care should be worried. If the Prime Minister is looking to Queensland as the best practice on how to manage health care, we are doomed.